Hello, welcome to the Soul Career. My name is Marketa and I'm the host of this podcast. I'm a holistic career coach, and on today's podcast, I'm talking to Jillian Smith, who is a registered dietitian, and she is specializing on gut health. We are talking about everything gut health, and you might be thinking of like how that is related to your career. Well, it is related hugely because your poor gut health actually is connected to so many issues that you might be dealing with on a daily basis, such as brain fog, constant tiredness, obviously digestive issues, and so many other stuff that you might be experiencing. And those things might be disrupting your career and your life on a daily basis. That is why I brought Jillian on this podcast. This is such an excellent conversation. I cannot wait for you to have a listen. But before you do, I would just love to give you a little bit of a disclaimer in case you are also watching this video on YouTube or on Spotify. My Zoom was acting up. I actually thought that something is wrong with my webcam. So right after I got a new webcam, and then I found out it was a Zoom issue. So during the time of our conversation, my camera keeps doing super strange stuff. It kept kind of like disrupting the interview a little bit. If you're just listening, you will not realize it. But in case you are watching, I'm so sorry for what you will see sometimes. But the conversation is great nevertheless. Somehow, I don't know how Jillian powered through that, but she just kept going with the conversation. She was not being disrupted. So this is also a huge thanks to Jillian. Anyway, disclaimer is over. Enjoy the episode. Take notes because what she is delivering to us is just pure gold. Enjoy. Hello, and welcome to the new episode of Soul Career. I have an amazing guest here today, Jillian Smith. Hello, Jillian.
Hello, thank you so much for having me.
I am so excited to have this conversation. We were chatting briefly, but I couldn't wait to just hit record because I don't want anything to be wasted potentially off the record. Jillian is a registered dietitian. Could you tell me a little bit more about what it means? Because I'm over here in Europe. I'm not even sure if we do have this specific term over here. So please explain me a little bit about what you're doing.
Yes, thank you. So yeah, I'm a registered dietitian. So all things nutrition is my jam. I help women. Really what my specialty is gut health. So I help women really get to what's going on inside of their gut and what's causing some of those, digestive symptoms, whether that be bloating or bathroom issues or stomach aches or heartburn, all of those types of things. And I really help them figure out what's going on inside of the gut and then help them restore and rebalance so they can feel so much better in their bodies.
I love that. And now somebody could be wondering, why me as a career coach? Why would I bring you on right now? And we would be talking about gut. Please tell me what are some other symptoms that people could have when they have gut issues that maybe they would not even connect it with a gut, and it might be really, really pretty much disturbing their life and existence.
Yeah, absolutely. So gut health, it's becoming more and more popular. More people are talking about it, which is so good. And I'm really happy about that because our gut health is so important. Our gut regulates so many different things in the body. And, they refer to our gut as the center of all health. And it really is because it kind of weaves into so many other systems. It's also referred to as our second brain because it has a really close relationship with our brain via this gut-brain connection. So a lot of symptoms that can be contributed to poor gut health are, of course, those more obvious digestive symptoms. Like I was saying, the bloating, constipation, loose stools, lots of gas, all that sort of things. But what some people don't realize is that gut issues can also look like brain fog, having difficulty concentrating, having a hard time focusing. It can look like skin issues. Mm-hmm. It can look like you getting sick all of the time because a lot of our immune system resides in our gut. So having poor immune system, it could look like things like hypothyroidism. If your thyroid's underperforming, if you have a lot of gut imbalances, it can throw your hormones off. So I work with a lot of women who struggle with irregular periods or really heavy, painful PMS, weird hormonal imbalances. So all of these things are contributed back to the gut. So I always tell people, if you struggle with feeling tired all the time, lacking energy, or if you just feel off in your body, start at the gut and work on optimizing your gut health, because that's going to really move the needle in so many different areas of your health.
It already sounds like a huge percentage of the population, doesn't it?
Right. Oh, totally. And I mean, gut issues are just on the rise. You hear more and more about people struggling with digestive symptoms. And, we could go all into why I think that that is why it is, but it really is on the rise. And so I'm really grateful to be able to do the work that I do and help people feel better in their bodies and improve their gut health, because it's not getting any better out there.
Yeah, I would actually love it if you dived a little bit into why do you think it's happening? Like, how is it possible that 10 years ago, I'm sure we were having completely different numbers? Like, what's going on right now?
Yeah. So, I think it's a big mix of a whole bunch of things. Number one, just our modern lifestyle, the stressors that we are exposed to all day, every day. We live in a very go, go, go society where there's lots of value put on high productivity and, really working and grinding yourselves into the ground. And as a result of that, your physical body really feels it. And particularly our gut health is really impacted by stress levels. And so when we're under more stress, whether that be, emotional stressors or going through a global pandemic, but it could also be more of those physical stressors like chemical exposure and different pesticides in our foods. All of those things really kind of start grinding down on our gut health. And over time, it can really cause some imbalances in there. On top of that, our modern diet is just not optimal. You think back to, 10, 20 years ago, the food in and of itself was much higher in nutrients, and we were eating more fibers and more nuts and seeds and fruits and vegetables. Now, fast forward to this day and age, it's much more reliant on convenience foods, packaged foods, kind of grab and go fast foods. I'm over in America, and we refer to it as the standard American diet. And, it's really, really poor, and it's really hard on our gut health. And so I think, all of these things are kind of getting stacked on top of our poor bodies every single day. And this just grinds down on our gut health. You also think about, all of the use of antibiotics. I think back to when I was a child, I struggled with my own gut issues for so many years. That's kind of how I got into this line of work. And when I was a child, I was on antibiotics all the time. And now in hindsight, I'm like, no wonder I had so many gut issues. I was getting plummeted with antibiotics day in and day out. So all of those things, really impact our gut health as a whole.
If I'm not mistaken, we are both the 90s babies, right? So
yes, we are.
we basically grew up on antibiotics.
Exactly. And, they just didn't know that the long-term effects of antibiotics. And, now we're understanding how big of an impact antibiotics actually have on the microbiome and our gut health. And so I think that's getting more taken into account. But yeah, back in the 90s, it was just handing it out like candy.
Exactly. I would like to say the way how we got connected actually is pretty amazing. So I started making research on gut health because of my own issues. I have been struggling with psoriasis for many years. If you maybe even want to explain a little bit what psoriasis is.
Yes, absolutely. So I work with a lot of women with psoriasis as well. Psoriasis is actually an autoimmune condition. So basically, your immune system is a little out of whack, and it's reacting to things that we don't want it to be reacting to. In the case of psoriasis, your skin, and that can, show up as those flare-ups on the skin. Like I had mentioned, over 70% of the immune system resides in the gut. So anytime we're talking about immune dysfunction, weird things going on with the immune system, we got to talk about the gut. And maybe you've heard of the term leaky gut. Have you heard of the term leaky gut before? Many of us have. It's basically when things that are not supposed to get outside of the GI tract are able to escape. And right on the other side of our GI tract is our immune system. So it trips up our immune system. And this is something that we see in a lot of those autoimmune cases. So really working on healing the gut is super, super important when we're talking about things like psoriasis or Hashimoto's or celiac disease or Crohn's disease. All of those fall under that autoimmune umbrella.
Got it. And exactly what you say. There, psoriasis for me was just one of the symptoms. There's also thyroid issues, constant headaches, constant loose stool. And the thing for me is that I never connected them leading to one root, one root problem of all of this. And I consider myself someone who is really into nutrition. I actually, looking back, I realized that I've been really interested in nutrition since I was 13, right? I do a lot of my own research. I read so many books on that, and yet I never find this information. How do you think it's possible?
Yeah, so I work in functional medicine. Kind of what functional medicine does is it's aiming to find the root causes to symptoms. And my background, I wasn't always in functional medicine. I actually worked in an acute care hospital, like in an ER emergency room, and I was the clinical dietitian on staff. And so it was a very different way of practicing medicine. And when I was working in the hospital, I just saw a lot of, oh, you have this symptom, take this medication. And it was like a lot of those Band-Aid type approaches. There wasn't a lot of emphasis on prevention. Like, how can we prevent you from getting sick in the first place? Instead, it was just kind of, you're healthy, you're healthy, you're healthy. Then all of a sudden you're sick and you have to get all these medications. So I started learning more about functional medicine. And that's really what I fell in love with, because it started giving me answers to what are the root causes. And I think functional medicine, it's starting to become more of a thing, which I'm really excited about. I think people are starting to understand the value in figuring out the root causes to symptoms, because kind of like you said, it can be so confusing when you have so many symptoms going on and you're just like, I don't even know the first step to take. And it can feel really, really overwhelming. And so that's kind of what I do with my clients, is I'm there to help guide and say, okay, this is where we're going to start. I'm going to help you through the process. So it takes out a lot of that confusion and overwhelm.
Got it. Got it. You were mentioning little bits and pieces of your story. Could you actually bring me like way more in depth throughout your story? How did it happen that you actually came to this field?
Yeah, absolutely. So let's fast forward all the way back to when I was in high school. That was kind of when I first started realizing that my gut health wasn't the greatest. I remember I was only pooping like once per week. I thought that was normal. It's not normal to poop just once per week. And, I remember my mom had gut issues, my sister had gut issues. So I just thought that was kind of normal. I went through high school, got into college. I started studying nutrition, and it was really in college where my gut issues hit their absolute worst. And, I think that was kind of a combination from a lot of stress, late nights, pulling all-nighters in the library, not eating the healthiest, all of those things, that my gut really became a huge, huge mess. Before we started recording, we were talking about, I used to live in Prague, where you also are from. And when I was studying abroad and I was living in Prague, my gut issues were such a mess. And I think it was just because I was traveling, all that stuff. So I was going through college, studying nutrition to become a registered dietitian. I was the healthiest out of all of my friends, and yet I felt the worst. I had the most gut issues. And I remember having to cancel nights out with my friends because I was in so much stomach pain. I remember I'd be out on date night with my boyfriend and would have to go out to his car and massage my stomach because I was in so much pain. So I graduated college, became a registered dietitian, and I started working in that hospital, in that emergency room. I was still struggling with my own gut issues. I was going to a lot of different doctors. I was getting all the tests, colonoscopies, endoscopies, tons of blood work. Nothing was giving me any answers. And then that's where I started learning more about functional medicine. And I was very intrigued by it because I was struggling myself. And if I could figure out the root causes to my symptoms, that's really kind of how I started getting into it. And so I started learning more about functional medicine. I went more into advanced training, specializing in functional medicine, figuring out the root causes. I did poop testing, which that's what I do with all of my clients. It's literally, we're looking at what's in your stool, but that tells us everything from your bacterial balance, infections, inflammation, immune response. So that's what I do with all my clients. That's what I did on my gut to figure out what was going on. So then I was able to set myself up with a plan for rebalancing my gut and healed my gut. And so now that's what I do and as my career, and I help other women do the same.
I love that. And I'm honestly so grateful on behalf of all of the women that you are helping, because what you're saying, it is so relatable. And actually, I had a similar experience on my date night with my boyfriend. When we were in Prague, was still just very freshly into the relationship. when he stayed over at my place, and after our dinner, I actually happened to not sleep at all, and I just had crazy diarrhea, and I was vomiting like crazy, and I had no idea what's going on. And
No.
that's still on top of the pain, right? That when you have these gut issues, it is, I'm sure you can say it's so painful. It hurts so bad. And the fact that it's happening every day to so many people, and so many people still haven't figured out the approach or the functional medicine have, it makes you feel so disempowered. It makes you not go for the things that you want to do. It makes you not go to the events, maybe not wanting the promotion. It makes you feel literally like a piece of shit.
Yes, absolutely. And I'm so glad you brought that up because I get so passionate about that. And like we had said in the beginning, they're so common. So many people are struggling with gut issues. Many people don't even talk about it. I find, especially with women, there's almost like some shame around it or some embarrassment. They don't want to talk about their stool or their poop or their constipation or their gas. And when we're just kind of suffering in silence, that really starts to impact other areas of our life. And, you don't have the confidence to go after that big job promotion. You don't have the energy to start up a side hustle to really work on your passion project. And so I am such a firm believer in, if you want to do anything in life, if you want to kill it in life, in your career, you have to feel good in your body. And that's really what I'm hoping to help women do.
Yes, yes. You keep mentioning women. Do you feel like gut issues are more of a women issues?
Yeah, so I predominantly work with women, so I do keep saying women, but yes, statistically speaking, yes, there is more of a prevalence of gut issues, irritable bowel syndrome in women. And so, I think there's a lot of different reasons why that is. Yeah, I think there's a lot of different reasons why women struggle more with gut issues. Maybe it's because, we are just reporting it more. But I don't know about you, but my boyfriend can eat anything and he never seems to have any issues. It's like a stomach of steel. And I feel like so many men are like that, whereas women's stomachs can be so much more sensitive.
I can so relate. And it's even worse how you then say that, how we have it so much connected with the shame even talking about this topic. I'm gonna tell you, I have zero shame talking about shit. And
Yes.
I'm even going to show you something, and this is gonna be on air. I actually got myself a little diary that I keep in my bathroom. I was actually very specific about what it's supposed to say. On the front, for people who cannot see it, it says "Do it with no regrets." On the back side of it, it says "Be proud of yourself." And this is my poop diary. I
I love that.
I started it like, I think 2 or 3 weeks ago. Well, actually, I have dates, I can tell you. So the first time I did that was January 24th. Today is February the 10th. And it's so interesting because in my head, I realized that I had an idea about what's happening in my bathroom. And I realized that maybe my brain is tricking me and I actually am not fully aware. So that's why I started to do that. Because, and maybe this is actually embarrassing, but not embarrassing for what was happening, but for me not realizing. I do have chronic loose stool, and I didn't realize because I was drinking so much coffee that I just was thinking like coffee is a diuretic, right? That's why it's happening. And I actually cut back on coffee and realized, oh no, it's a chronic thing. Why does this keep happening? Could we have a little bit more of a look on the difference between IBS, and now we know that there's IBS-C and IBS-D, right? And leaky gut. What are the differences between these issues?
Yeah. So you're right. We now kind of categorize IBS as IBS-C, IBS-D. So IBS-C is for constipation, IBS-D is for diarrhea, and they also have a category called IBS-M, which is IBS mixed. So you could actually struggle with both constipation and diarrhea, and that's actually pretty common. And a lot of times people will be like, how can that be? How can I be constipated but also be having diarrhea? And so many times what I find that create kind of these imbalances with our bowel movements is bad bacteria in the gut. So when we have a lot of bad bacteria, and that's I'm measuring for that in that poop testing that I was talking about. We can see your bad bacteria. And when you have a lot of that bad bacteria, it could kind of go one of either way. It could kind of be plugging you up, creating a lot of gases that cause more of that constipation, but it could also be causing a lot of inflammation, a lot of, a ruckus and damage and irritation inside of your gut, which can be leading to a lot of those more looser stools. And when the bacteria is kind of out of balance, and our bacteria is changing every 3 days, it's overturning. Bacteria doesn't live that long. So they're constantly dying and new ones are coming in. And that's why that whole picture can look different. You could be constipated some days, having diarrhea some other days. And whenever the bacteria is kind of out of balance, that's when we can start seeing those irregularities with our bowel movements. And so really what we want to work on is boosting up our beneficial bacteria, because that's what's going to lead to those more regular, healthy, sausage-like poops that we want every single day. And how we get that good bacteria up is through diet. It's eating lots of fruits and vegetables, lots of fibers and nuts and seeds, because those are the things that feed that beneficial bacteria. And we want to try to get out as much as possible those processed foods, added sugars, because those are going to be fueling the bad bacteria that we don't want.
Got it. So let's have a look at, let's say that we have this idea of a perfectly healthy person with a perfectly healthy stool. We're talking about regularity, shape, all of this. So when we say regular, what do you mean? How often should one poop?
Yes. So what's normal is anywhere from 1 to 3 times per day. So if you're not going every single day, then you have constipation. If you're going more than 3 times per day, then that's going to be more on the side of diarrhea. So 1 to 3 times per day is the sweet spot. And when we're talking about poop, we're getting into it. We're going to be talking about poop. We want it to be like a nice sausage shape. We don't want it to be super lumpy. We don't want it to be hard to pass. If you find that you're sitting on the toilet for so long, just trying to poop, then that's an issue. We don't want it to be those little rabbit pellets that sometimes people will describe it as, because that can be a sign of constipation. And of course, we don't want it to be mushy or complete liquid that it would be with that diarrhea. So the nice sausage shape, it shouldn't be overly stinky. If your stool is really stinky, I have some clients who are like, I describe it as it's room clearing. And if it's really, really stinky, that's an issue as well. That means that there's something going on the inside that we need to address. Shouldn't have a big stench, and it should be easy to pass without too much straining.
Understand. Well, I have work to do from what I'm hearing. And it's so crazy because it's even like what you say of like, I do consider myself being very healthy. I eat predominantly whole food, plant-based diet. All of this sounds like it should be good, but is there a way, because I've been mostly whole food. I definitely don't want to say that 100%. No. But I eat pretty healthy diet for the past like 7 years, right? It's quite a long time. Is there a way that even for, let's say, people like me, right, who think that they are quite healthy, that you maybe first need to do something and then feed yourself the healthy food to make sure that you're going to constantly be healthy? Or how does this work? Because I'm confused.
Yeah, it's so confusing. And that was me too when I was in college, and I was like, I'm the healthiest of all my friends. I eat so well. I'm studying nutrition, and yet my gut was so unhealthy. And truly, the first step I always say is, if you're kind of super confused and you're like, I don't really know what to do, if you're already doing everything quote unquote right, and you're eating all the right foods and you're really taking care of yourself, that's where the testing can come in handy. And that's where it really is super valuable, because you get to skip the guesswork. For you, maybe you just have a nasty little gut infection, or maybe some little pathogen or too much bad bacteria. And once we can rebalance that, then you start feeling better so much faster. So many times what we can find is even those like really healthy foods can be hard to digest. And if you have a lot of gut issues, it can almost be hard to eat those healthier foods because it's harder to break them down sometimes. And so by working on your gut health, you'll also find that you're able to now eat those healthier foods and be a lot more comfortable after them as well. So that's kind of where I always say is test, don't guess, get the test if you can. If you can't, something that I work with my clients on is, okay, maybe you have the most perfect diet and you're eating really, really healthy, but what are the other things in your life looking like? How is your stress? How is your sleep? How is your exercise routine? Are you overdoing it? Are you underdoing it? Because so much of that is also going to be impacting your gut health. It's not just all about the food. So there's a lot of factors that impact our gut.
I have so many questions on this. So first one, and I'm going to try not to forget the other one. First one is when we're talking about exercise and the type of exercise, and also as you concentrated mostly on women, does it matter where we are in the cycle, what type of exercise we do, or there's no correlation?
Yeah. So I recently started getting really interested in this. There's different practitioners out there, and actually a lot of people on Instagram I've learned a lot of this from, but there are different exercises that are more beneficial depending on your time of the month. And, like during ovulation, your hormones are higher. So you're able to do more heavier lifting, maybe more intense exercise. Maybe you can push it a little bit harder in the gym versus when you're in your menstruation phase or when you're leading up to that in your luteal phase. That's really the time where maybe it would feel better to do more restorative exercises like yoga and Pilates, kind of slow it down a little bit because of the hormone balances. You can absolutely use that to your advantage to really optimize your workouts throughout the entire month. And so I've been really, really leaning into that. And I think it's so, so enjoyable. And I also think it's very empowering as women, because if you're leading up to your period and you're just not really feeling it, you're not feeling like, oh, I don't really want to go to the gym right now. And so many times we can start getting hard on ourselves because of that, and, start feeling guilt and like, why can't I just be more motivated? Why can't I be more determined? And now knowing what we know about the hormonal balances, it's very empowering, because you can then understand, oh, no wonder I'm not feeling like, let's go pump some heavy iron in the gym today. It's because my hormones are not opt for that right at this time. And I know in a few weeks I'll be feeling more available for that. And so I think it's really, really interesting. And I love that more people are talking about it.
Yes. I mean, let's release the shame, right? That first of all, and also with that, let's cause less stress to the gut, right? Because for
Yes.
sure it's connected.
Oh, absolutely. Something that I see a lot with my clients is actually over exercising. So when we are over exercising, grinding our bodies just down into the ground every day, maybe, you have that shame or that stress around exercise, feeling guilty if you don't exercise. And that is really, really hard on the gut. Like we were saying in the beginning, stress really impacts the gut. Our stress hormones known as cortisol. And whenever our stress hormone goes up, that cortisol goes up, which with heavy exercise, it's going to go up. It directly impacts our gut. And it's kind of like a little punching bag to our gut, and your gut health can really suffer from that. So something that I actually work with a lot of my clients with is finding a more restorative exercise routine, and maybe bringing in more walking, more yoga, more Pilates, slowing things down a little bit so that your body can have the space and energy to actually heal itself.
This is super interesting. Hey, I just want to thank you for listening. And as a thank you for being here, I would like to offer you a free mini course called Get That Job. Now let's have a look of what is inside of this course. So first, we actually want to even get you to an interview. So we're going to learn about how to write a winning CV and how to write a cover letter if you choose to do so. Then we're going to have a look into how to actually act on an interview. We're going to go through some basics. We're going to talk about overall the mindset of being on an interview. And then of course, we're going to have a look into some commonly asked job interview questions and how to actually answer them appropriately. And last but not least, topic that I love to teach about on how to actually discuss the salary. So the salary talk can get super strange and super awkward. And sometimes it's from the side of a candidate, and other times it's from the side of a person who is recruiting you. So how are we going to discuss this topic without it necessarily being awkward? Because it's just money. Money is just energy, right? Let's get to it. Let's talk about it. And please, if you decide to do so, this is also like a welcome from me to my world and to the way how I coach on career. If you want to access this course, make sure to check the show notes for the link. And I will be looking forward to see you on the inside. Okay. Enjoy the rest of the episode. I would love to come back a little bit to the stress part. Now, this is from my research. Please, you are the professional here, so feel free to correct me. But from what I understood, the the lining of the gut is very, very thin. If I'm not mistaken, it's just like one cell lining.
Yeah.
So just by being stressed, you can right away hurt it very quickly. So is it possible to like be super healthy and then out of nowhere have leaky gut, but also to heal it quickly because the lining is so thin? Or how does this work?
Yeah, absolutely. So like we were talking about with that stress component, so many times I'll ask my clients, like, when did your issues start? When did your symptoms start? And, when did your psoriasis start? When did your autoimmunity start? When did your skin issues start? All of that, because so many times we can trace it back to a stressful life event. Maybe it's you went through a massive move across country away from your family, and that was a big stressor for you. Maybe you got a huge promotion at work and now there's a ton on your plate. Maybe you just had a baby and your body went through a massive stress of growing a human being. And a lot of times those big stressful events can be kind of that catalyst that starts everything off, because your gut is so closely impacted by those stressful events and those spikes in cortisol. And like you said, yeah, our gut lining, it's one cell thick and it's constantly turning itself over. And so what I always tell people is your body is so capable of healing, even if you feel like you've had gut issues your entire life. Maybe it's been decades that you've been struggling with gut issues. That does not mean that that's going to be your forever, because your body is constantly regenerating. Those cells are dying and restoring themselves 24/7. And so all we need to do is just figure out, okay, how can we relieve some of the stress on that cell wall? Where are the different stressors in my life, and where can I start deleting and delegating, start clearing up space? What's my nutrition looking like? And am I sleeping properly? Am I, all of those things. And if we can start dialing in and making small little changes in those various areas, that is really giving our gut the space that it needs to regenerate itself and to heal, so that you're not struggling with gut issues. So the human body is incredible and it's so resilient. And that's what I always am telling people. Like, it's only one cell thick. It's constantly healing itself. We just got to give it the resources that it needs.
That's for me just like, I love hearing that, because usually with most diseases, right, that when people are talking about, I mean, let's talk about cancer, right? You need to do crazy treatments and you're in it for years, and it might most probably going to be detrimental for you, right? The fact that we are talking about something here that might not take that long, it is so empowering. And it's almost like, why would you not, like, if the pain that you're going through is so huge, why would you not want to make a change and actually quite quickly heal it?
Yes, absolutely. And, I think that's kind of that functional medicine versus the traditional conventional medicine space. When I was struggling with gut issues, I was struggling with a lot of constipation. That was one of my big symptoms. And when I was going to the doctors, they were just giving me a pill, it was a medication to kind of flush me out. But my whole life was revolved around having to know where the bathroom was, because I knew once I take this medicine that I'm supposed to take every day, I'm going to have to find a bathroom immediately. And that was just no way to live. And, it's once we can start figuring out what is truly causing my symptoms, what is causing this constipation. For me, it was stress. I was struggling with a lot of stress and anxiety, and that was plugging me up. And so it wasn't until I was able to start doing some mindset work and releasing and really getting empowered about what my next steps are for my health, that I was starting to feel more calm in my body. And I don't need to take those medications anymore, because I healed the problem at the root.
I love that. And I can, again, so relate. I had the same thing. So as I mentioned, struggled with psoriasis for many, many years. Thyroid issue, again, the reason why I didn't connect it is because thyroid is in my family, right? And they always tell you anything connected to thyroid, oh, you have it in your family, so you're gonna have it too. And I get so mad. Like, I'm sorry. I love that the doctors become doctors and they want to be doctors. But I feel like so disempowered, especially because I really believe in the healing through nutrition, and that our bodies can heal. That when I go to a doctor, unfortunately, all of my issues ever in my life were chronic. And every time they would tell me there's nothing you can do, but you can take this pill. And it just makes me so mad that I don't even know right now, I got stuck in it. But what I want to say is that I never connected these things, that possibly something could be wrong with my gut. And around like 2 months ago, I went through a major stress event. I actually went through a breakdown completely. And what happened was that my psoriasis out of nowhere got crazy, and I got an insane rash all over my face and neck. It was hurting me so much. It's really painful, when these things happen.
Yeah.
And right now, I actually don't remember what was my bowel movements like. I don't know, but it was just like I had zero energy. I literally couldn't do anything. I couldn't get up from the bed. And I'm like, I knew it's connected to the stressful situation, but I would never think that it's actually going to do something to my gut lining. And then actually, even though it's just one cell, it's even the stressor, it doesn't go away right away, right? It still takes time. That's life, right? We still need to deal with life. And that's why I actually even found you that I started doing this research, because I was like, why did suddenly my psoriasis come back? I didn't even think about all the other stuff. And only when I started doing the research and I realized, oh, it's connected to leaky gut. And then I remember I heard this podcast. I actually had no idea who that was. I'm sorry for who I'm not going to quote, but they were listing like 9 symptoms that you have leaky gut. And I matched like 8 of them and like, holy shit.
Yep. And I mean, that's so huge with that, the psoriasis, definitely. And yeah, because that cell wall is so delicate, it's just one cell thick, it's easy for it to get tripped up. And so, something as little as, maybe your body was feeling some stressors, and sometimes we're not always even conscious to them, right? Sometimes some of us just kind of run more keyed up, more in that fight or flight response. Some of us just kind of have more of that flight or flight going. And that can really be hard on the gut, and any little thing can kind of trip it up and cause some of those flare-ups. And so everything that we can do to mitigate that and support the gut, the less of those flare-ups we'll be seeing.
Yeah. Now, the last thing I want to do is to disempower people and make them feel like every little single thing is going to make them extremely unhealthy. So let's have a look on, even when you say that, I know that you cannot say one number, but please say one number. Like, even when we look at how quickly can you actually heal a gut, how do you even recognize that you are healed right now?
Yeah. So that's the golden question, to be honest. And really how I describe it is gut healing, it's a journey. It's not a destination. Like, you're never really there. It's kind of like with anything with your health, right? You make healthy choices to support your health. You eat your vegetables and you drink your water, and those are just things that you do every single day because you know that is what's going to benefit you long term. Gut health is the same thing. It's just something that you make these little choices all day, and that just kind of is what equates to your overall gut health. And the thing with gut health, especially if you've had gut issues for a long time, it doesn't look like a linear line. It's more like a wavy roller coaster. And some days you'll be feeling really good. Some days not so good. I still have days where I'm like, oh, my gut is a little bit rumbly today, or oh, I have a lot of bloat this morning and I'm going to wear some leggings and not put regular pants on today. And so, those days are still going to come. And really what I tell my clients is that doesn't mean that you're taking steps backwards. It's just all part of the process. It's just the human body. And, who knows what maybe you ate and that just caused a little bit more gas production in your gut. It's no big deal and it'll go away. But really what I am helping my clients get to is a place where they do feel confident and empowered, and they understand what's going on in their bodies, and really reinstating that trust and appreciation for our bodies. I mean, I've said this before, the human body is incredible and it's such a miracle. And it's hard when you struggle with a lot of gut issues and just not feeling good in your body. It's almost like you lose some trust with your body. Sometimes you have some anger to your body because you're just like, why are you doing this to me? Why can't I just feel good? And so being able to get to a place where you can learn, appreciate, and understand your gut and for all the amazing things that it does for us is really where I'm trying to get my clients to be, and then mitigate those symptoms and not be struggling with them as much as possible.
I love that. I love that. I would like right now to go kind of into 2 routes. We're going to take them separately, obviously. But as you said, especially when it's really hurting, you can be really mad. I would like us to discuss some stuff that you can do immediately that can relieve the pain. And also, what do we do in the long run? How do we make this work?
Yeah, absolutely. So You mentioned the pain. A lot of times that really intense pain that we can struggle with is gas pains. And so it's when gas bubbles get all trapped up in our intestines, and there's a lot of nerve cells inside of our intestines. So even a little bit of gas can cause a ton of pain. And so if you are somebody who struggles with that really debilitating stomach pains, one of my favorite things to do is to just lay down and massage your stomach. Just, take your fist and just kind of start massaging your tummy, because that's going to help break up those gas bubbles so that they're not causing all that pressure on the inside of your intestines, causing you a lot of pain. So just simple tummy massages can be really, really powerful. Other things that I like to recommend is if you struggle with things like nausea, like after eating and you're like, oh my gosh, I just don't feel good, that didn't sit well. Things like ginger can be super, super helpful, or peppermint. So what I'll tell my clients is, you can just get tea bags and brew it really strong. Like do a mug of hot water, put 2 tea bags in there, cover it with a ceramic plate so that it traps in all of those gases, and let it steep for at least 15 minutes. So it gets nice and strong. And both ginger tea and peppermint tea can be really, really helpful for relieving some of those stomach pains, being uncomfortable. Other things like activated charcoal is always something that I just, have in my medicine cabinet for any time my tummy's just feeling a little bit off. Magnesium. If you're not taking magnesium, that is one of my favorite nutrients to take, because it's really, really helpful for relieving constipation, making sure you're going every day, also relieving that trapped gas. So lots of little tools that you can kind of have in your arsenal to pull out when things are feeling a little bit off.
This is really great. And if I'm aware correctly, there's different types of magnesium. Is there a certain one that you would recommend for issues like that?
Yeah, great question. Magnesium glycinate. So magnesium glycinate definitely is the one that I recommend. There are so many different forms of magnesium out there. I mean, you can go to a vitamin shop and they'll see a whole shelf full of magnesium, and it's like, which one do I choose? And I know when I was struggling with gut issues, I was just taking some willy-nilly magnesium that I just found at the grocery store, didn't really know what I was taking, and it made my symptoms a lot worse. The reason being is different forms of magnesium have different ways that they can be absorbed in the body. So magnesium glycinate, it's very well absorbed. So your body's going to absorb it. You're going to reap all those benefits. It's really great for your nervous system. So it helps to downregulate the nervous system, creating more feelings of peace and calm, less stress and anxiety. It helps you go poop every day. It's really good for your muscles. So if you work out a lot, really important for that. Whereas other forms of magnesium, they don't get absorbed as easily. So they pass through your intestines unabsorbed. And when that happens, it pulls in a lot of water, and it can cause more diarrhea, can cause cramping and all that discomfort. So magnesium glycinate is the form you want to look for.
Awesome. Is there a certain dosage that you would recommend, or what do you think?
Yeah, so it really depends. I like to recommend for my clients anywhere from like 200 to 600 milligrams. Just kind of depending. I always say you'll know that you're taking too much when you start having loose stools. So if you're taking a lot of magnesium and then you start realizing that you're having looser stools, just back off on the dose a little bit. But yeah, anywhere 2 to 6. If you're really constipated, sometimes I'll have my clients go up to like 800 milligrams, and that can be really effective. It's also really great for period cramps.
And how about those people who actually already have chronic loose stool? Is it okay to take magnesium?
Yes, definitely. Because when you're having loose stools, you're also losing a lot of nutrients through that loose stool, things like magnesium. So you can actually be deficient in magnesium. So I still recommend taking magnesium and just kind of starting at a lower dose, like maybe starting at 100 milligrams, maybe 200 milligrams, and just slowly working your way up. But you might just need a smaller dose of it, but still important to take.
Got it. And I have to say for myself, the days when I take magnesium, I'm feeling so much better. I can totally feel you. Yeah. Actually, something that I'm doing that I don't know if you've ever tried, it's a very simple hack, but similar to when you have period cramps, putting the hot water bottle on my tummy helps so much as well to relieve some pain.
Yeah. Yep, absolutely. And it's so great to have little tools that help you, right? Because there are going to be days when you just don't really feel that great. So having some tools in your toolbox to try out and see what works for you is really awesome.
Awesome. Now let's have a look at the long-term journey. What do we do? You were already mentioning that you want to eat a lot of fruits and veggies and fiber. What does it mean for those who are complete beginner into this?
Say that again?
Who are complete beginners into any kind of nutritional health.
Yes, absolutely. So what I always say is start by just eating more of a whole foods based diet. So whenever I say whole foods, it's meaning foods that come from the ground. So of course, lots of fruits and vegetables, potatoes, nuts and seeds, things that you can go out in nature and find. Try to bring in more of those foods, less of the foods that you find in a box or a bag or a package, because a lot of those foods, those are kind of the ones that you can maybe find in the center aisles of the grocery store. And those can have a lot of crap in them. They can have a lot of added sugars, lots of added, preservatives, additives, and some of those ingredients are really, really hard on the gut. Number one, sometimes your gut can't always recognize those ingredients. And so it makes it really difficult to break them down. They can fuel that bad bacteria that I was talking about. And so the more that we can start bringing in more of those whole foods that come from nature, less of those ones that we get in a box, the better your gut health is going to start being. Another tip that I always recommend is trying to have more meals versus snacks all day long. I find that especially a lot with women, we can be like little birds and just kind of eating little things throughout the day, a little handful of this, handful of that, just kind of snacking throughout the day. This is really, really hard on the gut. We actually want to leave about 3 to 4 hours between our meals so that our gut can have a chance to clean itself. And that's how it keeps its balance and that bad bacteria doesn't get so overgrown. So trying to do more, 3 to 4 meals per day, less snacking is also a really great hack that can make such a huge difference with your gut health.
Mm-hmm. I have seen that a lot of people also recommend fasting. How about fasting? How long is it okay for women? Where do you see this?
Yeah, so I have my opinions on it, and everyone kind of has their own opinions. So when it comes to fasting, I do not promote it for my female clients of menstruating age. Postmenopausal women, men, I more opt to recommend it, especially if there's, some blood sugar issues on board or some insulin issues, then maybe fasting would be more appropriate. I've seen a lot of hormone tests and I have never seen anything good come out of fasting for women who are menstruating. And the reason being is it just kind of messes up our hormones. It really increases that cortisol. Fasting is a stressor on the body. And so we have to take that into account. And thinking about, the person in front of you, or thinking about if you're wanting to explore fasting, is it really appropriate for you? Do you have a lot of health issues right now? Do you feel like you're under a lot of stress? Are you struggling with gut issues? If you're already kind of in that space, maybe fasting isn't the best choice for you because you're stacking on another stressor. At the same time, getting a little bit of a fast is beneficial for the gut, but that's more of like a 12 up to 14 hour. I wouldn't recommend going longer than 14-hour, but more like 12-hour fasting. So that would look like, if you stopped eating dinner at 7 p.m., then you can then have your breakfast at 7 a.m. And so it's just kind of that overnight fast is really all you need. Skipping breakfast, really trying to push it and not eating until the afternoon is really, really hard on the body.
This is so interesting because even the people who are speaking on fasting, it's what you say, it's usually men. And again, I'm totally stealing something here again. I don't have such a great memory to remember people's names and who said what. But I remember I was seeing this female researcher who was talking about all of these researches that are done when it comes to anything on the body. It's always done on men and women who are no longer in a productive age. So it's so interesting how much is connected to what you're talking about.
Yeah, exactly. And, there's a lot of promising research on the benefits of fasting, but it's like, okay, but who are these studies done on? They're done on men or they're done on postmenopausal women. The reason being is there's not as many factors, right? So if you're taking a woman who's still in her reproductive years, our hormones fluctuate, they fluctuate throughout the entire month. And so there's a lot more variables that these studies don't really want to have to take into account. Men hormones, postmenopausal women hormones, they're much more static. They're much more, they run on that 24-hour cycle. And so it's much easier to do these studies on that population of people because you don't have these hormone fluctuations getting thrown into the equation. So that's why most of those studies are done on men. And so we have to remember that when we are looking at the research and trying to see if something would be appropriate for us.
This is so interesting. Like for me personally, I am trying to also just to make sure that I keep a healthy relationship with food because it was not always my case, that I am trying to eat intuitively. So sometimes it's going to be that I'm actually going to break the fast at 8 a.m. because I'm really hungry. At other times, I'm gonna have my first meal at 10, right? Really, really different. And I'm seeing that the closer I am to my period, the more early I want to eat and the more I'm obviously hungry. And when it's actually just after my period has ended, first of all, I have less gut issues. I'm overall feeling more healthier, thinner, all of this, and just generally in better shape. And I actually don't even feel like I need food. And I personally don't force it. I'm not the type of person of like, this is the times when I eat and this is the exact portion and so on. I'm really eating more intuitively. And I feel like every time when I am on this kind of pace and I am fully in my environment where I can fully influence what I eat and how I eat, this is what really is working the best for me.
Yeah, absolutely. And, you're so right. Our hunger hormones change throughout the course of the month. And leading up to our period, our bodies are actually burning more calories. Our metabolisms are running faster leading up to our periods. So that's why some women feel more hungry. And it kind of goes back to that. Maybe that causes feelings of shame or guilt, like, oh, I shouldn't be eating this much. Like, why am I so hungry? And being able to have that understanding of, oh, that's okay. Like, you're just burning more calories right now. Your body is revving up its metabolism. Of course, you're going to be more hungry. You just need to have some more fuel. So being able to understand that and, have that knowledge can be so, so helpful. And, I don't know about you, but over here in the States, we're not taught about women's hormones through school. I didn't start learning this until, the last maybe year or so, like very recently. And I'm almost 30. And so it's really crazy that we're not really taught these things. And so I'm glad that more people are starting to talk about it.
And clearly, I mean, we are both learning about these things because we are very interested and very passionate about that. But still, most women still don't know it. It's even in their 30s, in their 40s, even after they already finished all of their cycles, they have no idea. And so even though you don't learn it in schools, there are certain skills and knowledge that you don't learn in schools, but you learn from your families. But just people just don't know about this unless you really are a scientist or a nutritionist who is really specified on this topic.
Yeah.
Actually, even we were supposed to talk just about gut health, but again, it's so complex, it's impossible to not to talk about the other topics. How about even like a cyclic acne that we think is again just connected to the period? Could that be linked to the health of your gut as well?
Absolutely. And, there's a lot of different ways that it could be. So, number one, our gut health plays a really big role in our skin health. And back when I was struggling with a lot of gut issues, I had horrible skin issues, really, really bad acne breakouts. I was put on Accutane, which is like a really intense skin medication. And I was putting on all these expensive creams and topicals and going to the dermatologist, and nothing was really moving the needle. And now knowing what I know now is it was all coming from the inside. Right. And so many times, we are putting on all the expensive creams and lotions trying to fix our skin issues, but really we got to go inside to the gut. The skin is like a window to what's going on the inside. So if there's a lot going on the skin, you got a lot going on inside of the gut as well. And so, it goes back to that leaky gut. If things are getting out of our GI tract when they're not supposed to, things like food particles or bad bacteria or toxins, then they're hitting our bloodstream, circulating throughout our body, causing a lot of inflammation, which can then show up as skin stuff. And then those things need to get out of our body somehow. And so they're going to go to our largest organ, which is our skin. So the leaky gut can show up as a lot of different skin issues. If you have a lot of bad inflammatory bacteria in your gut, then that can show up as gut issues. And then also hormonal stuff. So if you struggle with, that cyclic acne and maybe it's more related to hormones, we have to think, well, what's throwing your hormones off? What's causing these huge fluctuations in your hormones to where your skin is now starting to freak out from it? And again, it goes back down to the gut because the gut regulates our hormone health.
Really, the only thing I can say is this is so complex. So let's try to break it down a little bit. Let's say that someone is just listening, like, oh my God, I have all of this. I have all of this. What do? I don't want to overwhelm people, right? So let's just say that, as you mentioned, the best way obviously to start is to get testing. What if someone is in a situation that, let's say, either for financial reasons or for that they just cannot find anybody in their area? What's the best way to start if you cannot do this type of testing?
Yes, absolutely. And, I think there's so much that you can start on before even doing the testing. And predominantly nutrition plays a big, big role. Of course, what we eat every day definitely makes a big difference. So what I would say is start doing more of those whole foods, start shopping more the perimeter of the grocery store. Maybe start trying, maybe make a goal of every week, try one new plant food so that we can start bringing in different kinds of fibers into the gut because that helps your gut health a lot. So maybe try a new vegetable or try a new fruit that you've never had before and do a Google search on how to cook it and start bringing that sort of stuff in. So bringing in more whole foods would be a great first step. Doing less snacking throughout the day, more meals would be a great second step. And then I would say really take a look at your stress and starting to prioritize maybe 10 minutes every day you're going to dedicate to some sort of nervous system downregulation. So maybe that's going for just a 10-minute walk, or maybe that's, just doing a 10-minute meditation or just having some quiet time to yourself. So maybe do something every single day. It doesn't have to be for a long time, but something to start bringing those stress hormones down. And the more that we can do that and just get in the habit of it, the better that's going to be long-term. So those are some just really easy things that people can start doing today to start truly moving the needle with their gut health.
I love it. And I'm so happy that you actually brought the mindset into it. Just even the idea of how we're going to approach it.
Yeah.
I actually saw some researches on just by taking a few deep breaths before you actually eat and expressing gratitude over the food, that has a huge effect.
Oh my goodness, it's a huge effect. And that's another great tool that people can throw into their arsenal toolbox. 3 deep breaths before meals. So what that does is it puts you into rest and digest. And so many times we're multitasking while we're eating. Maybe you're answering emails as you're trying to shove a lunch in, or you're eating dinner over the kitchen counter as you're trying to get your toddler sat and calm down. And so many times, we're not sitting present with our meals. And when we're not present, we're not in that rest and digest. And so our digestion is not going to work as it should. So that can lead to a lot of symptoms, bloating, stomach aches after meals. And so if we could, when we sit down for meals, take 3 deep breaths, that triggers your rest and digest. That tells your body, okay, we're going to start eating, start creating all those digestive juices, your stomach acid and your enzymes, all of those things, start producing those because food's coming in, and that can really decrease our symptoms after meals.
This is so interesting. I actually, in my mind, to me, it was also connected to, and that would have been the next question. If it's supposed to be like a specific type of breathing, like breathing into your tummy, maybe, or if it just doesn't matter, it's just more about the way how you think about the breathing. Like where are we at?
Yeah. So the belly breathing is definitely the most beneficial. So that's when you're breathing into your belly. And I'd say try to make like your belly like a balloon. Like you want it to be coming from the belly. So many times we breathe up in the chest. And so, we kind of find that our breaths are up higher when really we want to bring it down lower. I always describe it. Have you ever seen like a baby sleeping? If you look at a little baby sleeping, you can see that their tummies are going up and down. And it's because babies naturally belly breathe. But as we get older and we're, under more stress, really we start doing it more from our chest. So bringing it back down to those deep belly breaths, super, super beneficial. And that's what kind of helps get you into that parasympathetic nervous system, which is like your rest and digest.
Amazing. How can we support, because you were also mentioning that we're gonna make sure that the acids in our stomach are going to be ready to digest the food. Can we support somehow the strength of the acid? Is it possible?
Yes. So stomach acid is really, really so important. And, I think a lot of times it gets bad rep because, people think, oh, I have a lot of heartburn, I have reflux, I must have high stomach acid. It's actually usually the opposite. When you don't have enough stomach acid, that's when you can start feeling heartburn, reflux, and all that discomfort. And when we don't have enough stomach acid, you're not going to be digesting your foods well. You're not going to be absorbing all of your nutrients well. And it also opens up the doors for more pathogens, bad gut bugs to get in. Because if you think about it, every time we eat or breathe or drink anything, we're bringing the outside world in. And having proper stomach acid is one of those first line of defenses that our bodies have to kill anything that could be coming in that we don't want to be coming in. So if you don't have enough stomach acid, then it can, continue on down your GI tract, taking up real estate in your gut, and then causing all kinds of inflammation and gut issues down the road. So having good, healthy stomach acid is so important. One of the best ways that we support our stomach acid levels is actually through chewing. So that's another hack, is really making sure that you're properly chewing your food, because the act of chewing signals to nerves down in our stomach to start producing that stomach acid. So if we're rushing through meals, if we're just kind of shoveling it in so that we can get out the door, and we're not properly chewing and telling our stomach, hey, start producing that stomach acid, then that's going to decrease our ability to break down that meal and lead to us not feeling so great.
These are such good tips. I love these types of tips. It literally is just like a little habit in your day. You don't need to be getting a specific medicine. It's just changing the little stuff during your day, how you're going to eat, how you're going to breathe. And it can already make such a huge difference. It's awesome.
Yeah, such a huge difference. And, that's what is so exciting about gut health, is there's just so many little things that affect it. So that means that there's so many little things that we can do to really move the needle, where you don't have to invest in, expensive testing or medications. It's just these little tweaks that we can make that make a big difference.
Awesome. I would love to come back to the topic of fiber. So we were mentioning that, okay, let's eat more plants and veggies. You were even talking about introducing different types of new plants into your diet. We know that fiber is not all the same. It's not only about the amount of grams that you eat. So how do you have some kind of hacks how to actually introduce the different types of fiber?
Yeah, absolutely. So yeah, like you said, diversity is really important. And so different bacteria in our gut eat different types of fibers and nutrients. And so in order to get the most bang for our buck and feed all of those different species of bacteria, we want to be bringing in different kinds of fibers and plant foods so that we can be feeding the most amount. So a lot of times what can happen is you get stuck eating maybe the same 5 foods, right? Like maybe every time you go to the grocery store, you're going to get your bag of spinach, you'll get your bananas, and you'll grab your apple. And that's just kind of what your family likes. Maybe it makes you feel good. And so you just kind of stick with those. But getting into that rut, we're then neglecting all that other bacteria that needs different fibers in order to thrive. And so that can be impacting our gut health. So that's why I'm given that tip to, maybe try each week one new plant food so that we can bring in more of that diversity. The thing with fiber is, especially if you struggle with a lot of gut issues, it can kind of sometimes be hard to digest. So increasing it slowly and gradually is always the way to go. If you're somebody who doesn't really eat that many fruits and veggies, but after listening to this podcast, you're like, okay, I'm going to start. Don't try to go all in and eat, breakfast, lunch, and dinner, tons of fruits and veggies, because it can make you feel bloated or gassy, causing some stomach aches. So increase it gradually. And cooking vegetables really helps it digest easier. So roasting them or putting them into soups or stews, that'll kind of help pre-digest those hard, tough fibers. And so that it'll be easier on your gut and feel better, leading to less bloating.
This is such a good tip. And also I remember on your Instagram story, we had a quick check about that. You were mentioning a very nice hack how to actually put more diversity into your diet when it comes to ice cubes. Please, could you explain this a little bit?
Yes. Okay. I love this. So this is a hack that I share with my clients when we're trying to get that diversity up, bringing in more plant foods. So what I tell them to do is go to the grocery store and go to the produce section and look for things that are in season, maybe they're on sale, inexpensive, and just start adding some different produce items to your cart. About 10 to 15 different kinds of produce items. go home and grab a handful of each and put them into your blender with some water and whiz it all up, and then pour it into ice cube trays and freeze them. And then every time you make a smoothie, just popping out, 2 or 3 of those ice cubes that are super full of those nutrient dense fibers and different plants, and adding those into your smoothies. And you're not going to really taste it at all, especially if you're adding in some other, fruit and things to sweeten it up, but you're introducing those plant fibers that maybe you never would have eaten otherwise.
This is awesome. I absolutely love this. And you're even, again, talking about the diversity when it comes to plants. I'm sure that you are familiar with the research of, I don't know how to pronounce his name, Dr. B. You know
I'm not sure.
No,
I'm not sure.
No. Okay, he wrote a book called Fiber Fueled. And
yes.
Right,
okay.
because he has I think it's a Polish origin of name, and I really have right now troubles remembering his name, but I'm gonna definitely link it in the show notes. And he's talking about something called the plant points. And instead of counting fiber, he's counting plants, how many, when it comes to the diversity. Do you, when do we know? The same way as I ask you, when do we know we're healed? When do we know that we have enough diversity in our food? How do we? I don't know.
No, I totally know what you're asking. So what I say a great goal to work towards, don't let this feel overwhelming, is 40 different plant foods per week.
Mm-hmm.
So what that means though is that different colors of the same food would count as 2 different ones. So like a green apple would count as 1, a red apple would then count as number 2. So trying to work up to that 40, but bringing in those different colors. So like different colors of apples, different colors of cauliflower, different colors of sweet potatoes, like when you can go to the store and you can see that there's different colors, those are going to be introducing different nutrients, feeding those different bacteria in the gut. So trying a big goal to hit 40 different species of plant foods per week is a really, really great goal. And for people who can hit that, it's pretty impressive. So that's always kind of the number that I encourage my clients to keep in the back of their head.
I think I'm hitting it.
Yes,
I wasn't sure what was the magic number, but if this is the magic number, I'm producing some magic.
Yes, you're getting in that diversity.
Amazing. Jillian, this has been amazing. And I'm sure after somebody who will be listening to this, they will want to know a little bit more about you. So what is it, how you work with people?
Yeah, so Instagram is the best way to get a hold of me. That's really where I meet people. That's where I met you. I'm on there all the time. And so I always encourage people, if you want to learn more about working together, about getting this gut testing I've been talking about, all of the things, I always encourage people to reach out to me on Instagram. My Instagram's just jilliansmith.rd. I'm sure you'll link it.
Sure.
And that's really the best way to get in contact with me. And so I work with women. I do work with men as well, but predominantly women. And I run an amazing group program. I do private coaching where we do the gut testing, hormone testing, vitamin level testing, all of the things. And I just really would encourage anyone to reach out to me if you have any questions, because I love talking about this stuff.
Amazing. And if people would reach out, what should they expect? How do you then work together? What would the process be?
Yeah. Yep. So I see all my clients virtually. And so it's, through this via Zoom, all the testing, it's super, super convenient. So I just send it to the person. They complete it from the convenience of their own home. You don't have to go into a lab or a doctor's office. Send it back to the lab. In about 2 weeks, I get results. And then in our sessions together, we go over them. And I typically work with people anywhere from 3 to 6 months so that we can really dive into all these different areas. And of course, the testing is super, super powerful, but I'm also doing a lot of work with nutrition, with lifestyle, with stress, because as we've been talking about this whole episode, all of that really, really matters. And so I work with women all virtually, and this is what we're working on, is dialing in what's appropriate for them. What are they doing currently? Where can we make some adjustments? And then having some data to help back up our recommendations is just really helpful.
All right. And if I'm not mistaken, you are based in Arizona, right? In the US. Do the people who work with you, do they need to be based in the US, or how does it work, at least this way, because of the testing, right?
Yeah, yeah. So Canada or the US is, as far as the testing goes, has to be either Canada or the US. However, that's just for the testing. And like I said, I do work with women, all over the world. And though we may not do the testing per se, we do a lot of work with nutrition, lifestyle, coaching, all of that. So
That's very good to hear. I actually right away assumed that it's not possible. So good to know and good that I asked.
yes, I'm glad you asked. Definitely possible. I mean, that's the beauty of telemedicine and being able to work with people virtually. So
Yes,
it's pretty awesome.
definitely, definitely. I would like to ask you one more question because I'm sure that right now, as there's this rise of awareness of gut health, there's also a lot of hype about probiotics. But there is not just probiotics. There's a lot of these different biotics, let's say, plus this poly something that I still don't remember the name of it. Could you just guide us through it a little bit? Like, what do all of these terms actually mean?
Yeah, absolutely. So lots of different terms. You're right. We have our probiotics, we have prebiotics, we have postbiotics. And when it comes to probiotics, we'll kind of start there. Probiotics really have to be personalized to you. And what can happen is sometimes people will take a probiotic and maybe they don't notice a difference, or maybe they actually feel worse and it makes their symptoms even worse. And the reason being, there's so many different strains of probiotics out there, and the kind that you take really needs to be tailored to what you have going on. So that's what I always work with my clients on. And I always say, don't just take any old probiotic. Ask me, let me know what kind of symptoms you have, and I can help recommend the right one for you, because some can actually make you feel a little bit worse. So probiotics are the live bacteria that when we take them, we're bringing in that live beneficial bacteria into our gut. Prebiotics are the food for those probiotics. So the probiotics are the bacteria. Prebiotics are the food for that bacteria. So prebiotics are going to be found in fruits and vegetables because that's what feeds those beneficial bacteria. Then we have our postbiotics, and postbiotics are basically the benefits that our beneficial bacteria produce. So our beneficial bacteria, they produce these different gases or these different short chain fatty acids, and they're very anti-inflammatory, very beneficial for us as humans. And so what the newest research now is, you can actually supplement with these postbiotics so that you can be getting those benefits of the beneficial bacteria. So those are kind of the differences between the prebiotic, probiotic, postbiotic.
This is amazing. This is so valuable. And especially what you're mentioning, like, again, we go to a store and probiotics are so hyped up right now, and nobody would be talking about the type, but only the amount, right? They would say there is, I don't know, I forgot the numbers because they're very high, but it would be like 20 million probiotics of take it.
Yeah.
But it's so good what you're saying, that you really need to know the right type, because otherwise it can actually cause you harm. So important.
Yeah.
Jillian, thank you so much. This has been amazing. I am so grateful that you shared your time here with us and guided us through all of this, because as we mentioned, it could be quite confusing to go through all of this by your own. I will definitely link all of your details in the show notes of this episode. It's going to be out actually in a few days, so we're going to be looking forward for that. And is there some last message that you would like to share with anyone here?
Yeah, well, thank you so much for having me. This was so much fun. And I mean, I could talk about gut health all day long. And it's so fun to do it with you because you're also so interested in it. So thank you for having me. And, something that I always just love to end with is helping people understand that you're so deserving of feeling good. And if you aren't feeling great in your body right now, if you just know in your gut that something is off, and maybe you've been to different doctors and they're not giving you any answers, maybe they're saying everything's normal, but you just know that you could be feeling better, that you are so deserving of feeling better, that you know your body better than anybody else. And if you need somebody to help support you in finding those answers and feeling better, seeking out support, because there's just nothing better than feeling good in your body. And I really want that for everybody.
Exactly. And I'm so happy that you have shared even these like practical tips of this one little thing that you can do today and tomorrow to make yourself feel a little bit better. Because we know that when the pain is acute, And we already know the worst thing to do is to just take ibuprofen or just some kind of painkiller. So knowing that we can do this little thing of this tummy massage or ginger tea and just feeling a little bit better today instead of crying ourselves to sleep, that's always a good option.
Absolutely.
All right, Jillian, thank you very much.
Thank you.